Well, here's another. It's been barely a week after some 400 students from 3 senior high schools in the eastern region were quarantined over the outbreak of variant virus disease, H3N2 flu. Now, already there are fears of another flu outbreak, this time here in Accra at the Presbyterian Boys Secondary School, Legon, PRESEC. Now, this afternoon, we're learning that some 30 students have been quarantined by health officials there. The school says that these students reported to the school's clinic complaining of headaches and general weakness. Nancy Emefa Jadosi was at the school, and here's what she found.
After receiving a distress call from a parent about an outbreak of a flu here at the Presbyterian Boys Senior High School, we decided to come and see things for ourselves. Now, when we got here, we found students in class with teachers teaching them, and so basically normal activities were ongoing. But one interesting thing we found was also a particular student who was wearing a nose mask. What this nose mask is supposed to do, we do not know. But what we do know is that the senior housemaster, Mr. Kofi Yesu, has been speaking. He says some students, about 30 of them between Saturday and today, reported to the school's clinic, and blood samples of 16 or 15 of them have been reportedly sent to Noguchi for further investigations to be done. Now, the school is expecting the report to be delivered later to the school today.
What I will tell the general public, parents and all stakeholders is that there's nothing like that in PRESEC. Yes, in a normal day, we have students visiting our clinic, especially when it's getting to mid-semester break and then the main semester break. You'll find a lot of them going to the clinic all because they want to go home early. And that is not different from what we are seeing at the moment. There are few people which people are anticipating or they think that they have been attacked by the flu. But we don't have the mandate, even if it is so, to pronounce anybody who has been attacked by something like that. So we call the Noguchi people, the municipal director of health also came around and we've taken blood samples, the saliva to the Noguchi institution for them to check or go through and then do their own investigation to find out whether indeed it is true that something of what you have mentioned in regards to the with regards to the bird flu is happening in PRESEC. But as I stand here, there is nothing like that.
But how many students reported ill between that Saturday and today?
From Saturday till we stand here, we have close to 30 students, yes, who are reported about different ailments. But that one is normal. We have 3,600. And the 3,600 each day, we have 3 nurses in our school, knowing very well what the children go through all the time. So every now and then, we have one person or the other going to the clinic to complain about ailment, and they treat the person. Yesterday, for instance, somebody was rushed to Legon Hospital. It was asthmatic. It was not anything in connection with bird flu. So if you ask me anything about bird flu, that is what I will tell you. I will want to assure the parents that they should stay calm. There's nothing bad happening to their wards. If anything bad, when the results come today, we will base upon that and then tell them what is going on. But as we speak, there's nothing bad going on in PRESEC. Classes are going on and lessons are also going on.
But you seem to suggest that there's absolutely nothing wrong when between just Saturday and today, you've reported about 30 students, and you don't think that at least there's a cause for worry?
That is what I've told you, that this is not the first time that we have recorded this. Over the years, you know, some people are panicking because of what is in the news concerning the outbreak somewhere. And we have lived with these boys over the years. They cough, they do everything. But now, if anybody coughs, you know what the next person is going to tell them. Hey, you have catch the flu. You have done this. You have done that. That has been in the system for a very long time. And I can assure you that as I stand here, there's nothing bad happening to PRESEC.
My final question, what are some of the symptoms? What do they complain about?
It's a normal headache. And nobody has complained about any strange diseases or any strange sickness.
What about weakness?
Well, even as I'm standing here, I'm weak. That doesn't mean that I'm sick, because you wake up, listen, my duties, you wake up at dawn, evening, moving up and down. So when sometimes the system becomes weak, it's normal. But the doctors are in charge and carrying out everything. And I don't think we need to peddle that kind of rumors and other things going on that there's flu in no. If it is somewhere, yes, I will believe that one. But PRESEC, as we stand here, we don't have anything like that.
Right, now let's speak to the Director of Public Health at the Ghana Health Service, Dr. Badu Sarkodie. He joins us live for a conversation on this issue. Thank you very much, Dr. Badu Sarkodie. First of all, what exactly has your team picked up from PRESEC Legon? What do we know for sure?
Indeed, not long ago, we had a report that there are quite a number of students in the school coming out with conditions which are similar to what we are managing somewhere else. Indeed, can you hear me?
Yes, we can hear you clearly. Please go ahead.
Can you hear me?
Yes, we can.
Yes. So immediately we reached out to the region and also to the District Health Directorate. And the feedback that we had, we needed to immediately respond. We sent a team from the national level to join the region and district to investigate. They are yet to come up with a report. But then I listened to the conversation with the person on the field that you just finished. And what I picked from it, indeed, over the past few days, there have been an upsurge of general conditions which include fever, cough, headache, general malaise, and whatever the situation, the report having come to us, we need to investigate thoroughly and make sure that we get to the bottom of it. If there is anything that is looming, then quickly we investigate and deal with it and contain the situation. But for now, the team that went to the field, I'm sure they are still on the field and we haven't had any report yet. The initial symptoms that we had, and by verbal report that students are having, included fever, cough, catarrh, general bodily illness, and these are the symptoms that we had by verbal report. Right. So we sent teams to go down to do thorough investigation. They are yet to give us any report yet.
Okay, so what is the process of testing here, and how long will it take? How soon will we know what exactly is happening to these students?
We've had a report of unusually high incidence of conditions. We are not going in prejudiced. You investigate the situation from first principle. But based on what we have experienced for the past few days from other schools, which we are managing, we are managing influenza type A, H3N2, which is a seasonal flu. It's among the common flu conditions that we have. It's all over the country. It's all over, not all over that widespread, but it is endemic in the country. It's endemic globally. So periodic people may have surge, and it is a cause for concern anyway, but the good thing is that this type of condition, quite a number of people may come down with the signs and symptoms which I've already enumerated, but then they are most often very mild ailments. But for now, as much as people are complaining of having a problem, we need to go down to the field and see what exactly is happening and investigate and respond to whatever they are having.
Since you are considering the possibility that it may be the same flu that popped up in another part of the country, is the Ghana Health Service doing any sort of contact tracing to try and understand the movement of the possible movement of this flu?
That is part of the investigation. Indeed, for every emergency that we do investigate, we do best to, one, establish what the situation is, how is it spreading, how are we going to respond to the situation that we are having and manage it, and then we further investigate to see and find out how the condition entered the place. So there is a thorough plan to investigate the situation which we have started.
Okay, so help us with some numbers. How many students are currently under quarantine at PRESEC? Can you tell us what their statuses are?
Let's use the terms right. You mentioned the term quarantine. You have to use it cautiously. When you say you have quarantined somebody, it means that the person has come in contact with an infectious disease condition. The person has not started having signs and symptoms yet. And then you are keeping this person within the period of maximum incubation period, so that whether the person will have the condition or not. We have not quarantined anybody. And as much as possible, if it becomes necessary that some of the students are coughing and you need to separate them from those not coughing, that is not a quarantine process. Let's get these things very clear and right. And the information that reached us, which made us send team to PRESEC, the information indicated that there are up to about 40 to 50 students having signs and symptoms since the past 3 days. And whatever the situation is, we need to find out from first hand to see what is happening and provide the needed assistance. That is why we sent a team to the field, a team of multidisciplinary, clinician, epidemiologists, laboratorians, people with laboratory background, health promotion background, so that when the children, the peoples or the students required to be given public education, right out there, you provide the needed advice that they need to adhere to the various preventive measures which would help us get the situation controlled and contained as early as possible.
To clarify, these students are actually not being kept in isolation. Is that what you're saying? Are they still part of the general population while your team is examining them?
They are in school, and if I heard correctly, the interview that was conducted with the person on the ground, he indicated that normal academic activities are going on, the students are going on with their normal activities. I said earlier, and I'll repeat it, that we are yet to receive any formal report from the team that went to the field. So, but then for now, the information that we have received, we have not quarantined anybody. If people have symptoms, and for that reason, the school authorities and the health authorities think that those with signs and symptoms should be separated from those without symptoms. It's a normal process which would help minimize the rate of spread and transmission of the condition. That is good, and if they adhere to it, it will minimize the mass spread of the whatever the condition, if it happened to be infectious condition that spreads by airborne.
So are you confirming that they've been separated?
The team that are out there to the field are very experienced. They will provide. Hello?
Yes, I'm asking, are you confirming that they have actually
Did you
been
ask any
separated?
question?
Yes,
further?
I did. I'm repeating it. Sorry, there's a delay. Forgive us. So I'm just asking if you are confirming to us now.
They have actually...
That they have actually been separated. Those with symptoms have been separated from the rest of the students. Are you confirming that, or do you not?
No, I'm saying these are part of the principles that we use in management of infectious disease conditions. If it happens if they need to be separated, I think it would be good that they are separated. But then I haven't had that report yet.
Thank you for that. Okay, so let's talk about the 3 schools in the eastern region where there was first cause for concern. What is the status of those 3 schools at the moment?
Indeed, for now, so far, so good. The case incidents have come down significantly. We had quite a number of conditions, students coming down. None of them, let me put it this way, all of them responded very well to the various measures and medication that we provided. None of them was ill for a period of about 48 hours. And as much as possible, the information that we have just about a few students, not more than 10, who are having mild symptoms and signs of the condition. So clearly the situation has subsided and we are getting to the bottom of it. At that area in the eastern region.
So, Dr. Badu Sarkodie, should you and the Ghana Health Service not be giving Ghanaians some education about what to do in this time when we believe that a communicable condition might be prevalent?
We have started the process for intensive public education, particularly at the areas affected, and as much as possible is helping so well. That is why we are seeing and getting fewer and fewer number of cases. What we confirmed at Eastern Region in the Lower Minya-Krobo district clearly came out to be influenza H3N2, which spreads by airborne, coughing at some, sneezing, and these are the things, situation that people without the condition get affected, and they are also infected. So a situation like this, what is very important is how do we let the general public be aware how the condition spread. And the people, we've started intensive public education and started talking to people, mass communication, one-on-one, how people should adhere to cough etiquettes. We have feedback that this is going on well, and how people should adhere to enhanced personal hygiene, which again, I'm aware that it has caught up well. Those that went to the schools to conduct the investigation, the school authorities have provided more facilities for hand washing, and the students are indeed using them adequately and effectively. And I believe for sure that these are the measures put in place which are being used effectively. That has brought the situation down, and we get into the end of it. So to the general public, there are certain simple measures that are very effective in preventing and protecting against disease conditions. And for conditions that are spread by airborne and air droplets, as influenza, the situation that we confirmed in the Eastern Region, Lower Minya-Krobo districts. Adherence to cough etiquettes is very important. And as much as possible, if anybody is coughing, you should do best to cover the mouth, either with tissue, paper, if you use hanky, you should wash it frequently. If you use tissue paper, you should dispose it as soon as you finish. And then immediately, if there's nothing in hand to use, you should cough at the elbow, that part of the body. People don't come into contact with others very often. So as much as possible, adherence to cough etiquette is very important. Any disease condition that spreads by air droplets, some of the droplets in the phlegm, in the sputum, they do drop on the surface of tables and other body surfaces. People may handle such surfaces. People may touch other contaminated surfaces and use the use of door handles and other tissues may also get infected. And as much as possible, frequent practice of hand washing with soap and water is very effective, so that you don't get your hand contaminated. Use your hand to touch your nostrils, to touch your eyes, or use it in eating and get infected. So it's important that we one, adhere to cough etiquette, two, enhance personal hygiene. These are very important measures for the general public. It helps to prevent and protect against quite a number of diseases, including the influenza that we are faced with in the eastern region.
Right. So let's learn a bit about this this particular strain of influenza. How dangerous is it? What's the mortality rate?
Indeed, most often it presents with mild symptoms and signs, and the fatality happens to be quite low. But then for every disease condition, you're not saying that it is a weak disease or non-virulent condition, so people should joke with it. The viruses, at times, whatever it is, they may change their situation and then behave differently. So as much as possible, the better and the best way is to prevent and protect against it, particularly as we are having it in high numbers in school setting, where we have quite a number of students together. They come in close contact in the classrooms, in the dining hall, also in the dormitories. And as much as possible, they interact with the general population. So the earlier we get to the end of it, the better. But then generally, the fatality is low.
Okay, how about the incubation period? How long before symptoms start to show after infection?
On the average of about 7 days, 5 to 10 days, maximum incubation period. So the incubation period is usually around 7 days.
Right. Will it be part of the Ghana Health Services rule to inform family members if indeed it is determined that the students at PRESEC have acquired the flu?
I mentioned earlier that this type of flu is a common flu, is a seasonal flu. It's not a new disease that has come from somewhere and has entered our school setting. So if you and me can cast our mind back, probably the past 1 month or so, you might have had a bout of catarrh, a bout of cough, and because we did not go for laboratory testing, we may think that we have not had it. So in the general population, in the general community setting, the viruses could be there. So as much as we are talking about it in the schools, should somebody have it, it does not necessarily mean that it is spread from the school setting to the general population. So whatever you are giving out to the students is applicable to everybody in the general population, and all should listen to this very well in good years.
Thank you so much, Dr. Badu Sarkodie, for that education there. We appreciate it very much.